No stranger to historical milestones, once again Institute Jantung Negara IJN reached a significant achievement in this region by being the first hospital in Asia to use bioprosthetic valves called the Tricvalve Transcatheter Bicaval valve system to treat leaky heart valves. I'm Jalisa Sanjana, and in today's Heart News, we will take a look at this innovative procedure that is designed for patients who suffer from tricuspid valve regurgitation. Tricuspid valve regurgitation is a condition that happens when the valve that separates the right lower heart chamber and the right upper heart chamber does not close properly. The valve is supposed to open up enough so that the blood can flow through and close tight enough to keep the blood from flowing backwards or regurgitate into the heart's upper chamber. While those who have mild tricuspid valve regurgitation are sometimes able to manage their symptoms with medication, most severe instances of the condition may require heart valve repair or replacement. Conventionally, the common surgical options for tricuspid valve regurgitation is annuloplasty, a procedure that tightens the ring around the valve in the heart. However, annuloplasty is not always suitable for patients that have other underlying conditions.
The way of doing things is we deploy two valves to kind of replace the function of the tricuspid regurgitation valve. So one valve will be placed on top of the heart, which is at the superior vena cava, and another valve will be replaced at below the right atrium, which is the inferior vena cava. So by doing that, we are able to take over the function of the regurgitant tricuspid valve. Now, because the valve is so big, it's a 27 French device, it is essentially about 8 or 9 millimeter in size. So we need to open up a big hole at the leg, at the femoral vein, so that we can deploy the valve in the two positions that I mentioned earlier.
With the involvement of the Tricvalve technique to treat this condition, patients who are considered high risk for surgery and are unable to control their symptoms through other treatment can utilize this to alleviate their symptoms. The Tricvalve system allows patients to avoid open heart surgery, as this procedure delivers the valves directly into the heart via a catheter. Some of the common symptoms of tricuspid valve regurgitation include fatigue, abnormal heart rhythms, shortness of breath, and swelling in the legs and abdomen. Although these signs often do not develop until the condition becomes severe, in most serious cases, the condition can lead to heart failure.
The selection of patients for this procedure has to be done quite extensively, because technically what we want is we want patients who are symptomatic, who have symptoms, for example, shortness of breath, and they are also not stable enough for them to go for conventional surgery, for example, a valve replacement. So these are the types of patients that we want. But of course, the patient cannot be too sick. So this is the device, what we call Tricvalve. So the valve is actually implanted here at the top here, and this is the part where we twist in order for us to deploy the valve inside. So what we do is we prepare the groin. So we put this inside our femoral vein, which is the blood supply in the leg, and then we put it up into the heart, and then there will be two valves. One we put in the SVC, supravena cava, and the other one we put in down in the IVC, inferior vena cava. So technically what we need to do is we need to have two of these devices that we put in for each patient that requiring Tricvalve.
Treatment using the Tricvalve Transcatheter Bicaval valves is not only minimally invasive, it also offers patients a quicker recovery period. The duration of the procedure itself takes around 30 minutes, which is much faster compared to the annuloplasty procedure, which usually would take about 5 hours. Just like the introduction of this innovative heart valve treatment procedure, the team at IJN is always on the lookout for new, safer and more efficient ways to bring better healthcare to its patients and improve their quality of life. I'm Jalisa Sanjana, and don't forget to watch us on Facebook and be sure to subscribe. See you then.